All right. Good morning, everyone. My name is Joseph Baez, and I am the Director of Corporate Training at E&I. I would like to thank you for attending this webinar this morning on COVID-19 mental health awareness for anxiety and depression. I also would like to thank you for your continued partnership with E&I. E&I hopes that everybody has continual good health and is staying safe out there during this difficult time. I would also like to say a happy early Mother's Day to those out there. Just don't forget to, give mom a phone call or text message something to let her know that, you're thinking about her during this day. So today we're going to be talking about, mental health awareness and specifically in regards to anxiety and depression. As we know, the COVID-19 pandemic is presenting a range of challenges and stressors in our personal and professional lives. And as the norm of everyday life has changed, our perception during this stressful time must provide our greatest chance of maintaining that balance between work and life. So today I'm offering a lot of guidance to help you navigate the unique situations for yourself as well as your family members, coworkers on mental health awareness and prevention. Our agenda today is pretty simple. We're going to be looking at the impact that COVID-19 has had on our society, on our workforce today. We're going to look specifically at how the differences between anxiety and depression, although may be linked together by common symptoms and signs, are very different in their own perspectives. Then we're going to be looking at specifically the signs and symptoms that we want to be keeping an eye out for ourselves, for our family members, for our friends, as well as, even our coworkers. We're going to look at mental health at work specifically today as well. A majority of people recognize that a lot of their stress and anxiety stem from the work environment. So we want to make sure that we're addressing that. We're going to look at some coping mechanisms that are available to us to make sure that we're maintaining good high level of mental health. And then finally, we're going to look at support and resources, available things out there to make sure that we're getting the necessary care and services for keeping our mental health in good shape. So when we're looking at the impact of COVID-19, the outbreak of the coronavirus may be stressful for people. Fear and anxiety about a disease can be overwhelming and cause strong emotions in adults as well as children. Stress during an infectious outbreak can include significant behavior changes. And what we're really looking at is fear and worry about not only your own health, but the health of your loved ones, the health of your friends and family. We're also looking at some significant changes that we're seeing on a day-to-day basis. We're seeing people who are having a lot more differences as far as their sleep patterns and eating patterns as well. Maybe you seem to be munching a little bit more. Maybe you're just so stressed out, have a lot of anxiety and depression going on that you're not eating as much or the way you should be. We're seeing a lot of people during this time as well that are having difficulty sleeping and even maintaining a high level of concentration that they normally would have on a day-to-day basis. For people who have chronic health problems, what we're seeing is a worsening of that during this time, as well as the worsening of mental health conditions as well. And I know that for a lot of people, maybe we're battling an increased use of alcohol or tobacco use or other drugs. It's important to remember that how you respond to the outbreak could depend on your background, the things that make you different from other people, and the community that you live in. People who may respond more strongly to the stress of COVID-19 during this crisis include older generations, people with chronic diseases who are at a higher risk for severe illness from COVID-19. We're seeing also children and teens that are being deeply affected as a result of this. People who are helping with the response of COVID-19. We have doctors, we have healthcare providers, first responders on the front line, but every industry in some way is affecting this as a frontline responder in some manner. And what we're also noticing is that people who have mental health conditions are having a significant reaction as far as high levels of stress, depression, and anxiety. And that can also include problems of substance abuse as well. This in turn has generated higher levels of anxiety and stress within ourselves, within our family units, and within the work environment. So stress is ubiquitous and it follows us everywhere. Since there's simply no way of avoiding it, the task that we have for ourselves during this time is to ensure that our own mental health becomes an opportunity for us to further understand and improve management skills within ourselves. COVID-19 has seamlessly managed to create stress, anxiety, and the development of depression. Our mental health is challenged with the implementation of isolation, social distancing, and self-quarantine. As a result, many individuals are finding it difficult to find balance between work and life. Before COVID-19, we were able to leave the office, and to some degree within ourselves, we were able to switch off from work mode. But now we have converted our living rooms, dining room tables, spare bedrooms into our office space. And as a result, we're constantly engaged in our work. And that mode of being focused on our work is affecting our mentality. For some, they're working longer hours to maintain the same level of productivity in the office. On top of working from home, we could be multitasking between work and taking care of our children, our family, and even just our sanity. We are also becoming inundated with constant media information, adding to the surmounting stress and anxiety that we feel on a day-to-day basis. So where is our stress, our anxiety, and our depression stemming from during this time? Well, financially, what we're seeing is there's a lot of people right now who unfortunately are facing unemployment and it's on the rise, whether they're being laid off, furloughed, or forced into an early retirement. For a lot of us, it may be we're losing a lot of our income and we're reaching into our 401ks and our investments in order to sustain our the same lifestyles that we've had before. We're trying to ensure preventative measures of spreading COVID-19. Businesses are mandating less employees in the office and storefronts, causing an influx in hours worked and within their salaries. The financial obligations, unfortunately, are still there and they still need to be met on a monthly basis. And the unemployment benefits that are supposed to be coming to us may be a little bit slow as far as received on our side. From a relationship standpoint, we're seeing increased anxiety and depression from being separated from our loved ones, as well as there's with the constant contact that we're having with our family in our households, they're leading to more marital and relationship problems and increased arguments within the family. We're also seeing, sadly, a higher chance of domestic violence as a result of being confined within our homes with our relationships. We're seeing emerging issues of grief that is manifesting. For some of us, it's missing going to certain places, having that personal freedom, seeing our friends. For our children, it's difficult for them not to be able to go outside and play, go to the playground, and enjoy the environment. And for some of us, it's also knowing that we're losing loved ones as a result of this pandemic. From a wellness standpoint, it's affecting our physical, mental, and emotional well-being. We're challenged to stay, the challenge is to try and stay physically fit and maintain proper nutrition, but what we may be having is increased snacking or not even eating enough to maintain that nutrition that we need on a day-to-day basis. For spiritual wellness, it's difficult because a lot of these religious organizations have closed their doors to make sure that we're providing a safe area to congregate during those times. We're seeing increased cases of sleep deprivation, and there's a lot of social health concerns that are happening now, and I know will come about later on in the future because of the stigmatization of COVID-19. What we're going to see is we're going to see a lot more people as this pandemic starts to slow down and we're able to reintroduce ourselves back into our normal work days and the communities. A lot of people are going to be avoiding each other. There's going to be a lot of people who are just not going to feel as comfortable interacting with each other on a day-to-day basis. So as the cases of COVID-19 increase, so does the associated anxiety. For the general public, the mental health effects of COVID-19 are as important to address as the physical health effects. And for the 1 in 5 who already have a mental health condition, or the 1 in 2 who are at risk of developing them, we need to take personal, professional, and policy measures now to address them. For the past several weeks, the Mental Health America organization has been using unique databases to monitor daily increases in anxiety. And according to their screenings, they've experienced a 31% increase in screening for clinical anxiety since the first week of February. And I'm sure that's significantly increased as this has continued to go on. This suggests that the screeners are not just worried, instead they represent thousands of people whose lives and sense of well-being are being severely impacted by concerns about this virus. Now, let's remember that anxiety is a normal reaction to stress and can be beneficial in some situations. It can keep us alert to dangers and help us prepare and pay attention. Anxiety refers to anticipation of a future concern and is more associated with muscle tension and avoidance behavior. A perfect example of this is anybody who lives in an area where there's significant snowfall. When you're getting ready to take on your morning commute or you're going to the store, and you know that the weather conditions are preventing you from driving safely on the road, you're not going to go out there with the mindset that you're going to do the normal speed limit, get on the highway and maintain, the speed limit that's posted. Instead, you might have a heightened sense of anxiety about driving because there is that concern about what could possibly happen if the driving conditions are not in the best manner for you, your family, to get to the destination that you need to. It's important also to know that when it comes to depression, it's more of a timetable from there. So when we're looking at the feelings of depression that last more than 2 weeks, feelings of depression can include hopelessness, extreme sadness, lack of motivation or initiative, possible weight change, sleep change, thoughts of suicide or wanting to die, or not being able to fully enjoy what you once enjoyed in the past. It's normal to experience feelings of sadness and lack of motivation from time to time, but if they hang around for a while and impact your life and your work, it could be time to talk to a healthcare provider. Remember that depression and anxiety are not the same. Depression and anxiety disorders are different, but people with depression often experience symptoms similar to those with anxiety, such as nervousness, irritability, and problems sleeping and concentrating. But each disorder has its own causes and its own emotional and behavioral symptoms. Many people who develop depression have a history of anxiety disorder early in life. There is no evidence one disorder causes the other, but there is a clear evidence that many people suffer from both disorders. Now, in regards to anxiety and depression, what we're looking at is kind of what the root cause of some of these issues are. And what we found is that it comes down to essentially 2 types of stress that manifest within ourselves. There's acute stress, in which there's a response to immediate perceived threat, either physical, emotional, or psychological. The threat can be real or imagined. Our perception of the threat that triggers the response is primarily motivated behind that. And once the event or the situation that produces the stress is over and removed, the body returns to the relaxation state and all is well again. So slamming on your brakes after you almost get into a collision, acute stress, your body, heart rate increases, increased breathing, sweating. That's what we're looking at as far as acute stress. From chronic stress is due to prolonged states of ongoing environmental demands. It occurs when the body's experiencing so much stressors that the nervous system rarely has a chance to activate the relaxation response. With chronic stress, it has been found to play a role in so many of the modern diseases that we see today: depression, migraine, heart attacks, cancer, diabetes, and all of these account for more than half of our country's health-related expenses. Individuals who live with chronic stress are now often learning to live with the new normal and not realizing that the chronic stress is slowly killing them. So anxiety and depression share a biological basis. Persistent states of anxiety or low moods involve changes in neurotransmitter function. While the biological functions of these problems are similar, anxiety and depression are consciously experienced differently. Be mindful that many of the signs and symptoms of anxiety and depression mirror each other. Many people with anxiety also develop depression and vice versa. About roughly 50% of people diagnosed with depression will also be diagnosed with an anxiety disorder. However, it's important to get an accurate diagnosis in order to treat the correct condition. Many people with depression may experience what is known as an anxious distress in addition to their low mood. People with anxious distress often feel tense, restless, and have trouble concentrating because they're worried so much all the time. They are deeply afraid that something bad is going to happen or that they might lose control of themselves. People who experience anxious distress with depression may be at a higher risk for suicide or need more intensive treatment. So it's important to identify these symptoms along with depression. Now on our screen here, we have a lot of different signs and symptoms to keep in mind for. Not going to go over all of them, but just be mindful that a lot of them copy each other and mirror each other. So although we may be looking at one sign, just be mindful that we may be, that individual or yourself may be experiencing some other form of anxiety or depression or stress as well. Now, mental health at work, what we're noticing is that most individuals, when looking at stress, anxiety, and depression, are stating that a lot of it stems from the work environment. So about 45% of employees say that anxiety or depression is hurting their productivity in the office, or at least on occasion, while nearly 1 in 5 employees, so roughly about 18%, say that anxiety or depression interferes with their work all the time or often. As a result, poor mental health and stress can negatively affect employees, their job performance, their productivity, their engagement with their own work. Communication with their coworkers is being affected as well, along with their physical capability and daily functioning. What's important here is to make and utilize personal connections, especially when you're feeling stressed. Don't go it alone. Isolation has a way of blowing problems and stress out of proportions. Studies show that social relationships are a powerful buffer against stress. In fact, studies in Europe and the US show that people with fewer friends and family ties have a significantly shorter lifespan. Also, other studies show that primates have found that socially isolating animals have a higher level of stress hormones, a reduced immune response, and a higher mortality rate. Family and friends can usually tell right away when you are being unreasonable about a situation. Most of our friends and family can give us helpful advice and help us reframe a situation if we're not able to do so ourselves. Now, when we're looking at coping mechanisms for our mental health, we do have a lot of quick remedies that we can utilize to take control of the situation. Now, these remedies right here can be utilized for adults as well as our children, our friends. So it's important that as we start to develop this for ourselves, we want to implement this for our friends and our families as well. So first thing you want to do is you want to question your thought pattern. Negative thoughts can take root in your mind and distort the severity of a situation. One way is to challenge the fear, ask if it's true, and see where you can take back control. You also have the option to practice deep focused breathing. Try breathing in for a count of 4 and breathing out for a count of 4 for 5 minutes total. By even breathing out, you'll start to slow your heart rate and it will help you calm down much quicker. There is a technique utilized, it's called the 4-7-8 technique, that is known to help anxiety, in which you breathe in for 4 seconds, you hold that breath for 7 seconds, and then you're releasing that breath for roughly about 8 seconds. This will allow your body to get back into that relaxation response that happens after a moment of stress. We're also seeing increased use of aromatherapy. So whether using oil forms, incense, scents, or candles, scents like lavender, salandala wood can be very soothing. Aromatherapy is thought to help activate certain receptors in our brains, potentially easing anxiety. Try focusing on yourself by going for a walk or doing about 15 minutes of yoga. Sometimes the best way to stop anxious thoughts is to walk away from the situation. Taking some time to focus on your body and not your mind may help you relieve a lot of the anxiety that you're feeling. Also, write down your thoughts if you have the opportunity. Write down what's making you anxious. Get it out of your head and make it less daunting. This also provides you the ability to know that when you're writing it down, you can kind of start to justify as far as what's causing the stress, the anxiety, the depression. And then later on, when you start to feel those again, it's a great resource for you to go back to and see what caused it and how you can best improve a coping mechanism for yourself in the future. Now, while short-term solutions are great in the moment, a lot of times we may need some long-term strategies to make sure that our stress, our anxiety, and our depression are under control. So if anxiety is a regular part of your life, it's important to find treatment strategies to help you keep you in check. It might be a combination of things like talking to a therapist or meditation, or it might be a matter of just cutting out or resolving your anxiety triggers. If you're not sure where to start, it's always helpful to discuss your options with a mental health professional who might suggest something that you hadn't thought of before. So first thing you might want to do is identify and learn to manage your triggers. You can identify triggers on your own or with a therapist. Sometimes they're very obvious, like we're drinking too much caffeine, we're drinking too much alcohol, we're smoking. Other times they're less obvious. Long-term problems such as financial or work-related situations may take time to figure out. Is it a due date, a person, or a situation that's causing it? This may take some extra support through therapy or with your friends. When you do figure out the trigger, you should try to limit your exposure if you can. If you can't limit it, like it's due to a stressful work environment that you can't currently change, use other coping techniques that you find. You also want to look into adapting some kind of cognitive behavioral therapy, or CBT. CBT helps people learn different ways to think about reactions to anxiety causing situations. A therapist can help you develop ways to change negative thought patterns and patterns and behaviors before they start to spiral out of control. Look into implementing some kind of daily or routine as far as meditation. While this does take some practice to do successfully, mindful meditation, when done regularly, can eventually help you train your brain to dismiss anxious thoughts when they arise. If sitting still and concentrating is difficult, start trying some kind of yoga routine. Try supplements or finding a change in your diet. Changing your diet or supplements is definitely a long-term strategy. Research shows that certain supplements or nutrients can help anxiety reduction, whether it's omega-3 fatty acids, green tea, dark chocolate in moderation. However, it does take up to about 3 months, studies show, before the body's actually running on the nutrition of these herbs and foods that you're providing it. If you're taking medication through this time, just make sure you're discussing your herbal remedies with your healthcare provider. Keep your mind and body healthy. Make sure you're getting out and exercising regularly, eating balanced meals, getting enough sleep, staying connected with people who you care about is a great way to starve off the anxiety symptoms. Finally, ask your doctor about medication. If your anxiety is severe, that your mental health practitioner believes you benefit from medication, Understand that there's a multitude of different directions you can go depending on your symptoms, but it's important to make sure that you always discuss your concerns with your primary physician or mental health professional. Now remember that our emotional intelligence right during this time is significant to our overall success. It gives us the ability to reflect on our own emotions and manage them proactively. So you want that self-awareness, figure out who you are, recognize those feelings and emotions that are happening. The self-management aspect, once you know that we understand that we're going through a stressful situation, how are we going to manage ourselves to make sure that we keep ourselves and our emotions in check? From a social aspect, once we figure out how we manage our own emotions, we want to make sure that people that we're around on a day-to-day basis, our family, our friends, our coworkers, we want to understand their emotions, their needs, their concerns. Pick up on those emotional cues. It's going to be helpful for the relationship management that we have, because as we're better able to pick up on those emotional cues, we're able to adjust ourselves and make sure that we're building trust, that we're building rapport and that mutual respect for people during this difficult time. So for our mental health and well-being, there are a bunch of support options and resources to stay mentally healthy. So from a support aspect, we want to show empathy and be more available to everyone, as well as family, friends, coworkers. Stay connected and communicating, and utilize meeting tools if necessary to stay connected. Recognize that everybody's in some way may be impacted by isolation and loneliness, and encourage training on stress management and other topics of interest that can help them better equip themselves with how to handle situations like this. Utilize reliable information for that. The CDC, the World Health Organization, the American Psychiatric Association all provide great resources and information to help us better equip ourselves with dealing with anxiety, stress, and depression. Use community-based resources. Maybe there's a lot of things as far as what we can't utilize within our communities right now, but food banks, public transportation, the health department, faith communities, housing, care providers, they're all out there providing services for our communities. So reach out to them if you do need it. Finally, look into your health plan benefits. Telemedicine is a safe and effective way for you to see a doctor, to receive health guidance from your home using your smartphone, tablet, computer-enabled webcams. With E&I, we have a partnership with MeMD, which offers you the ability to see a provider if necessary. Remember, your total well-being NextGen EAP is always available for you. It's confidential, no cost. With it, you have the ability to see a counselor, whether it be in person, telephonically, or through video-based sessions. Legal and financial consultations, where you can speak with a professional for a 30-minute time frame and handle a lot of the issues that are maybe stemming as a result of COVID-19 and your impact of that. Virtual concierge. Now, if you're looking for more information on how to deal with your stress, your anxiety, depression, what's available in your area to assist with getting provisions for yourself, your family, daycare services, and much more, this is an unlimited access for you to get all the information you need for that. The wellness resource gives you access to the wellness coach and wellness resources, dietary options, how to prepare specific meals, mental and emotional wellness that we want to focus on during this time. Health advocacy provides you the ability to assist in managing and resolving health insurance issues that may be coming about during this time and in the future. And finally, we have the option for e-caregivers as well. Now, this is only for, not only, but it provides people on the East Coast the ability to find and manage private pay home healthcare services for their loved ones. If you are not located on the East Coast, I would highly encourage you to utilize our virtual concierge service to help you find those resources as well in order to provide you the necessary care for your loved ones. So at this time, I would like to open up the floor to anybody who has any questions in regards to the presentation, any anxiety. So one of the questions is, will the slides be available? Yes, it will be available. I will make it available through after the webinar and email this out to everybody who has participated. There's also going to be a recording of this as well. So if this is something that you feel would be beneficial to to somebody else who unfortunately didn't have the opportunity to be in here this morning, a great opportunity for them to see that as well. All right. Well, thank you again, everybody, for joining me this morning. Again, my name is Joseph Eisen. I'm the Director of Corporate Training at E&I. Just a couple contact information for everybody out there. Remember that you always have access to the call center on the 1-800-327-2255 number, utilizing your Balance Benefit app or the NextGen EAP app, and then also access to the web portal at www.nextgeneap.com. Utilize your human resources components if you do need that. One of the questions that was just asked, will there be a link we can share to families for us working in schools? Yes, so the link that will be provided for this video and all the content can be provided once we're complete with the webinar. Again, thank you so much for joining me this morning. Happy Mother's Day again to everybody out there. Have a safe and wonderful weekend, and we'll keep you updated on any additional webinars as they start coming through in the future.